Home care is more than a service, it's a lifeline. A lifeline that preserves dignity, promotes independence, and provides cost-effective solutions for seniors and their families. The time has come to reimagine healthcare with compassion and practicality, ensuring every senior can thrive in the comfort of their own home. Our seniors face impossible choices between paying for care and meeting basic needs. It's time to remove these barriers and prioritize a system that works for everyone. The solution is clear: compassionate, barrier-free home healthcare that delivers dignity, savings, and better outcomes.
The Monitoring Senior Services report highlights where seniors' needs are being met and where improvements are urgent. Our aging population is growing fast. In 5 years, wait lists for long-term care beds have more than doubled to 6,500. Seniors are spending unnecessary time in acute care hospitals, averaging 36 days while waiting for placement. With wait times as high as 225 days for others, barrier-free home healthcare is an urgent solution.
Expanding home care offers clear advantages. First, it allows seniors to age in place, preserving their dignity and independence. Second, it provides systemic savings by reducing hospital admissions and delaying the need for long-term care placement, freeing up critical beds. Finally, home care can be implemented much faster than constructing new facilities. Accessible, personalized home care benefits seniors in their daily lives, fostering independence and connection while strengthening the healthcare system overall.
Aging in place offers countless benefits. It helps seniors maintain independence, enhances quality of life by keeping them in familiar surroundings, and is more cost-effective than long-term care. Staying at home strengthens community ties and allows for personalized care tailored to their unique needs. Aging in place isn't just preferable, it's practical and compassionate. British Columbia stands at a crossroads. Seniors, who currently make up over 19% of our population, will represent nearly 26% by 2043. This demographic shift is set to significantly increase healthcare spending from 7.6% to 8.6% of our GDP.
In this video, we use the terms home care and home support interchangeably, but it's important to note their distinctions. Home care focuses on medical and nursing services provided by licensed healthcare professionals, addressing needs like medication administration and chronic disease management. Home support, however, involves non-medical assistance with daily activities such as bathing, dressing, and meal preparation, provided by care aides or community health workers. Both services are essential for helping individuals live independently, and are film advocates for greater accessibility to both, ensuring comprehensive support for seniors and others in need.
Home support and Better at Home programs work together to meet both health-related and daily living needs for seniors. Home support focuses on personal care and medical-related tasks, such as bathing, grooming, and mobility, provided by trained community health workers. Better at Home, on the other hand, offers non-medical services like friendly visits, transportation, and minor home repairs, often delivered by volunteers or contractors. Both services are vital and fully covered under a barrier-free model to ensure seniors receive comprehensive, accessible support. Research shows that 1 in 9 newly admitted long-term care residents could have been treated at home with the right supports. Most older adults want to stay at home. Providing proper assessment and care can reduce unnecessary LTC admissions, freeing up over 1,700 beds in British Columbia alone.
Seniors in rural areas are 50% more likely to enter long-term care due to limited home care services. Those living alone face even greater challenges, being twice as likely to require long-term care as seniors with family support. Expanding home care access can reduce these disparities and help more seniors stay in their communities. Women make up 2/3 of new long-term care residents in Canada, with over half aged 85 and older. On average, women live longer than men, making them more likely to live alone and less likely to have an unpaid caregiver for support. This lack of support increases the likelihood of early admission to long-term care. Expanding home care options can help women age with dignity and remain in their communities longer.
Let's look at home support programs in British Columbia and Ontario, highlighting their services, target populations, and funding structures. In BC, programs like Home Support and Better at Home focus on personal and non-medical support, funded through public health authorities, sliding scale fees, and partnerships with organizations like the United Way. The Cecil program addresses complex medical care for high-needs patients and is fully public. Meanwhile, Ontario's Home and Community Care Support Services and Community Support Services, CSS, offer a broader range of care, from personal care to meal delivery, through both public and nonprofit collaborations. Ontario also emphasizes integrated care with Ontario Health Teams, OHTs, for complex cases, and provides tax credits for home modifications, which BC currently lacks. These differences reflect varying approaches to home care between the two provinces.
These statistics reveal a critical issue. British Columbia lags behind in leveraging home care as an alternative to long-term care facilities. With 12.9% of long-term care clients who could have been cared for at home, BC trails provinces like Alberta and Ontario. By admitting people to nursing homes unnecessarily, BC misses opportunities to provide cost-effective, dignified home care. Expanding home health care would not only reduce strain on long-term care facilities, but also improve quality of life for seniors who prefer to age in place.
This slide highlights a significant gap in long-term care planning across provinces. In British Columbia, 12.9% of long-term care residents have clinical profiles similar to those who could have been cared for at home, much higher than Alberta or Ontario. Even more concerning, 61% of seniors entering nursing homes in BC had no prior access to home health support. This underscores the urgent need for barrier-free home healthcare solutions to reduce unnecessary institutionalization and provide seniors with the care they deserve at home.
Income thresholds and financial tests create unnecessary barriers to barrier-free home health care. Low-income seniors may qualify for waived fees, but moderate-income and working seniors face capped or income-tested charges, adding complexity. Eligibility for GIS exemptions is tied to strict income definitions, leaving many seniors to navigate confusing regulations just to access care. Eliminating these financial tests is essential. By removing income-based restrictions, we can ensure equitable, accessible care for all seniors, reducing financial strain and simplifying the system for everyone.
British Columbia faces the highest home care costs in Canada, with seniors paying nearly $9,000 annually, far exceeding other provinces, many of which provide this care for free. This disparity puts a significant financial strain on BC's seniors. In contrast, our film advocates for free home support for all seniors through the removal of co-payments.
Many seniors face barriers when it comes to choosing home care as their first option. Awareness gaps mean that some are simply unaware of the home care options available to them. Cost concerns, whether real or perceived, create the belief that home care is unaffordable. Access issues are also common, especially in rural or underserved areas where services may be limited. Additionally, institutional care is often seen as more reliable or comprehensive, shaping care preferences. Cultural norms and community beliefs can further favor long-term care facilities over home care. For families, the fear of burdening loved ones with care responsibilities adds another layer of hesitation. Finally, misconceptions about home care, such as the belief that it only addresses minor or temporary issues, prevent many from exploring this as a viable, long-term solution.
Cost comparisons highlight the financial barriers of home support for seniors earning $29,000 annually. Housing costs $17,200, while food adds $5,200, both included in long-term care. Health expenses for home support are $3,100, with personal care costing up to $9,000, pushing total costs beyond $30,000. In contrast, long-term care costs $25,900, leaving $2,000 in remaining income. This disparity makes home support unaffordable for many, despite being the preferred option for aging in place. A shift toward barrier-free care is vital to ensure fairness and accessibility.
We advocate for barrier-free home care as a solution to the many challenges seniors face today. This approach eliminates all co-payments, ensuring seniors can receive the support they need without financial or bureaucratic obstacles. Barrier-free home care recognizes home support as a right, not a privilege, allowing seniors to age with dignity in their own homes. It preserves independence, promotes well-being, and meets the growing demand for care, while reducing the strain on institutional systems. Fully funding home health care isn't just a compassionate choice, it's a financially smart one. Currently, the annual cost of long-term care per senior in British Columbia is $82,000. By contrast, providing 1 hour of daily home support would cost only $14,100 per year. The cost of living in a government-run nursing home in British Columbia for 2025 varies widely. At the minimum, clients pay $17,594 per year, while the maximum reaches $48,880 annually. These rates are based on 80% of a resident's after-tax income, ensuring a range that reflects their financial capacity.
These slides highlight a tremendous opportunity for the BC government to save millions by transitioning eligible long-term care residents to home care. Currently, 6.1% of the 29,000 long-term care residents, around 1,769 individuals, could be supported at home instead of in facilities. For just 1 hour of daily home care, the cost drops dramatically from $59,900 per client in a facility to $14,100 for home care. This change would result in an annual savings of over $81 million. As the number of daily hours increases, savings decline but remain significant. Even at 4 hours of care per day, the government saves over $6 million annually compared to nursing home placements. The chart highlights the efficiency and cost-effectiveness of investing in home care over institutional care. The question is clear: why wait to implement a solution that saves resources and prioritizes the well-being of our seniors?
Using a sliding scale for home care funding falls short, as only 8% of seniors earn over $100,000 annually. This means the potential revenue generated is minimal, while 92% of seniors fall under this income level. Barrier-free home care ensures equity, reduces systemic costs, and guarantees support is available for all seniors without unnecessary obstacles.
By 2040, British Columbia faces a dire shortage of long-term care beds, as shown in this graph. The red dashed line represents the current shortfall of 3,000 beds, while the blue line highlights a steep rise in demand, projecting over 30,000 additional beds needed by 2040. This trajectory underscores a critical challenge. Relying solely on LTC facilities will lead to unsustainable costs and overcrowding. Let's consider a thought experiment. Investing in home care instead of building new nursing homes offers striking savings. In the first year, a nursing home bed costs $330,000, while home care costs $90,000 for 8-hour daily support. Over 5 years, nursing home costs total $650,000 per client, compared to $450,000 for home care. a $200,000 savings. At this rate, it would take 25 years for home care costs to match the upfront investment in nursing homes, showing the long-term benefits of home care.
Home care provides a faster and more efficient solution to meet the growing needs of seniors. It can be implemented within 24 months using existing resources, reducing hospital bottlenecks and avoiding delays. In contrast, nursing homes require 5 to 7 years for planning, construction, and staffing, with high upfront costs of $250,000 per bed. These delays and expenses make home care not only the quicker, but also the more scalable option to address immediate and long-term senior care needs. Home health care offers seniors the chance to remain in their own homes, preserving their independence, dignity, and overall well-being, a choice that most prefer as they age. At the same time, it's a cost-effective solution, reducing unnecessary hospital stays and avoiding the high expenses of institutional care, saving millions of dollars that benefit both individuals and the healthcare system. With personalized care, seniors receive timely support, lowering the risk of emergencies and complications while easing the strain on hospitals and emergency services. By making home care accessible and affordable for seniors at all income levels, we eliminate financial barriers and ensure no one is left behind. This approach combines independence, savings, better health outcomes, and equity, making home health care a truly transformative solution for the future. We believe barrier-free home care should be a fundamental right for seniors, just like medical treatment. It means removing all barriers, ethno-cultural, cognitive, and bureaucratic, so access is simple, quick, and equitable. By eliminating delays and hurdles, we can ensure every senior receives the support they need to live with dignity and independence. How can I make an impact?
Contact your MLA and let them know that you support barrier-free home care.
The Jewish Seniors Alliance of British Columbia is committed to improving the lives of seniors by reducing isolation and loneliness among vulnerable older adults. We engage with seniors through outreach programs, community support services, Senior Line magazine, and dedicated advocacy efforts. Together with our community partners, we advocate for universal free home support for all BC seniors, ensuring that home care support becomes the first and best option available to every senior in the province.